Welcome to the Innovations in Clinical Implementation podcast, the Ovation Lab and A4M series that helps clinicians translate cutting-edge tools and emerging technologies into practice-ready strategies. Today, we're building on one of the most talked about themes at Longevity Fest, the evolution of the AI-enhanced practitioner. I'm Dr. Lexi Gonzales, naturopathic doctor and senior clinical implementation and AI specialist at Ovation Lab, and I'm joined by Dr. Sunjya Schweig to explore the next phase of this transformation, how clinicians move from being consumers of AI outputs to producers of AI tools that amplify reasoning, reduce friction, and elevate clinical consistency. Dr. Schweig is a double board certified physician and a leading expert in functional and integrative medicine for complex chronic illness. He is the founder and president of the California Center for Functional Medicine and the founder of the Functional Medicine Research and Technology Center, where he focuses on data-driven, precision approaches to preventing and reversing chronic disease. With over 25 years of experience studying, teaching, and practicing functional medicine, Dr. Schweig works at the intersection of clinical care, research, and health tech innovation to improve outcomes for patients with conditions such as Lyme disease and other complex multi-system disorders. Welcome, Dr. Schweig.
Thanks for having me. It's a pleasure.
So we just came off the stage talking about the AI enhanced practitioner, and we walked them through three transformations: from friction to flow, from data to insight, from personalized to precision. And we touched upon this next wave of moving from AI consumer to producer. So just from your perspective, what is that shift for you, and how can we best translate what that shift is to the practitioners listening today?
Yeah, so like you, I've been, a very avid consumer of AI, meaning I subscribe to too many platforms,
Yeah.
right?
Yes.
And I'm using them, and basically just trying to experience what are they helping me with, how is it a value add, and then also where are some of the gaps and where are some of the frictions, right?
Mm-hmm.
And so like we spoke today at A4M, we're both very bullish on this technology, and we're in the weeds with our clinical workflow as well as various aspects of our lives, right? But we're going to these platforms, we're using what they're giving us, and we're consuming that capability as a consumer, right?
Mm-hmm.
Asking it questions, taking what it gives us, and using that in some aspect, right? But then there's a transition which I've started to really think about as you start to experience the values, but also start to maybe learn to push the limits a little bit of what's possible,
Mm-hmm.
right? And it was actually Tom who originally introduced me to a gentleman named Steven Scleroux, who showed me Quiet Diet, which was a custom GPT that he had built. You probably remember it,
Yes.
right? So that was the first time I had been exposed to build your own GPT,
Mm-hmm.
right? Which sounds kind of complicated, right? Like, whoa, OpenAI builds GPTs. How could I ever think to build a GPT? But it's not very complicated, right? So you can go into basically giving it a preset set of prompts and going into the back end, you can upload files that the query talks to. You can preset the questions that people might be able to think to ask,
Mm-hmm.
and you can give it some parameters. You can toggle on or off the ability for it to search the web,
Right.
and look for other information. So you can just keep it restricted to your content,
Mm-hmm.
etc. Right? And so that's a very easy, low lift experience of now moving from consumer to producer, where you're using a platform, but you're producing your own experience, right?
Mm-hmm.
And it was really fun to demo on stage.
That was
today.
so cool.
Wasn't that
was
great?
so fun.
So we got everybody up and we demoed this custom GPT that actually my daughter Kaya and I built as part of a Stanford AI class that we're both taking. And basically walked us through the proper form of doing some squats, why they're important for health span and longevity, and it took the audience through an experience of doing this exercise together, right?
Mm-hmm.
Really engaging, really fun. Our patients love this stuff, right?
Yep.
And so another one that we built, that I built, was around crunching data around sleep studies, right? And so we use the sleep image ring. I'll send it home with the patient, and I ask them to do 5 nights of data collection,
Mm-hmm.
and because I want them to just wear the ring by itself for a night or two to get over that sort of first night effect of like, what is this thing? It's weird. Is
Right.
it working? Is it not working? Is it recording? And they have bad sleep because of that.
Right.
So they get used to it. And then, for a couple of nights, and then I have them do mouth taping on nights 3, 4, and 5, but in different conformations. So night 3 is vertical, night 4 is an X formation, and then night 5 is a cross. And then we're looking at that data to see were there benefits. Right?
Wow.
And so you can take all those CSVs. I built a custom GPT, which basically says, I'm going to upload 5 CSVs of sleep data, of de-identified sleep data. You're going to generate a table that compares them across nights, and you're going to flag any based on these normal ranges that I give you. Right?
Wow.
So it's just like a preset, basically. Right?
Wow. Yeah, I think building custom GPT is probably the lowest lift. The example that I can think of that been fun to play around with you is this idea of food journaling.
Yeah.
And it's a little bit archaic now because it's kind of built into things like Aura and continuous glucose monitor apps now. But this idea of patients being able to just snap a picture and get some immediate feedback about what they're actually eating from a macronutrient content or phytonutrient content,
Yeah.
and then providing some immediate feedback into how they can actually enhance that meal. Super big value add for patients because it's all of the interim in between visit support that I'm unable to provide that patients can kind of access at their leisure. And so outside of custom GPTs, what other tools have you been building using kind of this transition into being an AI producer?
Yeah, so the next step for me has been learning how to vibe code.
Mm-hmm.
And so what is vibe coding? It's basically being able to interact with these coding platforms from a natural language point of view.
Mm-hmm.
And I don't know about you, but I don't have any experience coding. Right?
None.
Right, none. And
except copy and pasting it into wherever I needed to embed it.
Right.
Yeah.
So all of a sudden we can now start to build things, build an app, build a website, build an interactive dashboard.
Mm-hmm.
And it can be super simple or it can be really complex.
Right.
You can link via APIs. You can have sign-ins. You can implement a Shopify cart or a purchasing system.
Mm-hmm.
And so they're not completely intuitive. There's a little bit of a leap there, but you can get in there and you can build something that's probably 80 to 90% of the final product just by tinkering with it, right?
Yeah.
And what happens, and so some of the things that you do is you just put an idea in there, you see what it generates, and it comes back to you. You play with it, and a lot of times the first iteration, like something doesn't work. And you might say, hey, this thing doesn't work,
right? And
you tell it that, and it starts to work. And it's like, oh yeah, you're right. Let me fix that, and then it comes back to you 5 or 10 minutes later, And so I remember when you were building one of your vibe coding tools, you taught me also like just take a screenshot of the error code and say, what does this mean, and fix it.
Yes.
And then it does.
Yes. Like I said, my tech background isn't very deep.
Yeah.
So I'm very reliant on the AI to actually help with a lot of that tech stuff. And that, helping it identify what the error is that it flagged has been a helpful cheat code for how to vibe code for those of us that don't have the tech background. I want to take a step back, actually, because we mentioned a lot of skills and tools in the session without actually naming any of the tools. So I'm curious, what is in your current AI tool stack specifically for clinic work? Yeah.
So I looked at a lot of different scribes. I tried out Freed extensively, and I tried out Heidi, and some of the other ones that I haven't used as extensively, but I'll name just for people to look at. I would say look at Abridge, look at Nabla.
Open Evidence.
Open Evidence has a scribe. I did play with that recently and wasn't super knocked out by it, but it is teasing some of the future capabilities, which I want to come back to.
Yes.
The reason why I started using Heidi exclusively is because it does quite a good job. I felt like the outputs from Freed without tinkering were better, the assessment and plan, but Heidi is much more customizable.
Yes.
And so you can set templates, and you can also interact with the scribe as it's scribing.
Yes, please dive into that, because I think that's a really cool add-on to what the scribe can actually do outside of just transcribing.
Yeah. So Heidi as a scribe and AI note taker. There's another non-medical platform called Granola that I use a lot for just regular meetings and for conference talks. Same kind of thing, an AI scribe. That one's non-medical, non-HIPAA, don't use it for patients.
Yes.
Heidi is medical, is HIPAA, you can use it for patients. But while it's still recording, quote unquote, while it's still listening and transcribing, quote unquote, listening, you can go into the chat box and you can ask questions. Right.
Yeah.
And so you can say, summarize, and in Heidi also it has context from several visits prior, and so it knows what's happening at this visit, but also knows what happened at the last few visits. And you can say, summarize this patient's back pain. Give me a detailed summary, including any interventions and any specialists they saw, and it will just give you that rundown of everything that happened. So that's been really, really helpful. You can also copy and paste the transcript while it's being generated in real time. It doesn't stop it from generating. You can take what's there already and put it into your LLM of choice. And so that's really, really powerful. Granola, the meeting note taker, has a funny, a workflow Or you can even ask it questions like, I spaced out, what should I be thinking about?
Yeah.
Or it has a funny one, it's called, make me sound smart.
Yes.
Give me like 3 questions to
Yes.
ask. And it's crazy. And they give you like really cool questions.
Yes.
You
Yeah.
know, which is, a little conflicted about that because, again, you don't own that knowledge, but still, it's, the ability to interact in real time and, and generate, interact with that data. It's almost like a second brain in a way.
Yes,
right?
yes. And one of the things that I also really like about Heidi is the amount of outputs that you can build from one template. So it's not just the chart node, it's not just the care plan, but one of the biggest time savings is care coordination.
Yeah.
And when someone is, going to a new provider, you can quickly summarize the patient's chart based on all of the transcripts and produce a pretty comprehensive timeline to send to another practitioner.
Yeah, referrals are amazing.
Oh my gosh, such a time saver.
Yeah, or if it produces a note that you don't love,
yes,
you can say, redo this section and it will generate it and it'll ask you, do you want to replace what's there? Do you want to open up a new tab?
Yes.
That's been really powerful.
And so, building off of the scribe tools, data synthesis.
Yeah.
I think one of the most exciting pieces of integration with AI is the new tsunami wave of dashboards that are available for practitioners, either inherently built into a native EHR system like Vibrant Practice, which is super exciting for practitioners that want an AI native platform.
Yeah.
And then we think about some more dashboards like Biocanic and Heads Up Health and Bioscope AI that you can layer onto your EHR system. So I'm curious, have you looked into AI dashboards and how you actually integrate all of this wearable data in a safe way?
Yeah, absolutely. We've actually been doing a new deep dive on this recently. And one of the companies that I advise called Peak Health, they're actually launching tomorrow here.
Oh my gosh.
So watch out for that announcement. But they're doing a really innovative thing about being this next generation system, right? In terms of this sort of not mythical, but this thing that we all want, this co-pilot that's there with you, that's generating content, generating information, synthesizing everything that it can see across, right? So I use Servo as an EMR right now, and it's what I would call a legacy EMR. And I don't think that the database structures are set up properly to be AI-able, right? And so it's just not optimized. And so I really do believe that there does need to be platforms that are built from the ground up, that are AI first, that are AI native, and that really, bring us to that next reality. When we talked to A4M, we spoke about that we're kind of in this like uncomfortable teenage years, right? Things are starting to come together. There's some really cool capacity. There's some really cool knowledge and wisdom and smarts. But it is not always predictable, and sometimes things break and they get out of hand, and it's like it doesn't, it's not where we need it to be.
Right.
In 1 to 3 years, we're going to be in a very different place.
Yes.
Right. And I really see this co-pilot level interaction where all of the data is constantly being scanned and synthesized, where it's surfacing insights, it's using the scribing tools, it's listening to your discussions with your we record all of our clinician meetings, right? So our knowledge base as clinicians is coming in, and so training the models that way.
Great idea.
And basically not taking over for us at all, but generating insights that leverage us up another level.
Yes.
Right? And Bioscope is a very interesting. I've just learned about them here.
Yes.
Excited about what they're building.
Totally.
But I also see in all these platforms that they're not there yet.
Yeah. Right.
So that's why I'm giving it like a 1 to 3 year horizon.
Yeah.
I love what Sunita's doing. But nobody really has nailed it yet. So I'm just waiting with anticipation.
Right. And something that I think we've learned as we've been trying new AI tools is before you jump right in, the AI tool has to go through some bug fixing and refinement with more users, which is why something like Perplexity, Claude, ChatGPT, they're so good at what they do because there's so much input from all of the users. And to that note, something that we didn't get to touch on in our talk is, with the ability to actually consume all of this data, we're actually creating some value for the patient's health record and the investment that they're putting into actually collecting all of this information. It is another kind of skill, I guess, as a clinician to actually building this health record equity for this, data pool that you can now input into AI, which I think is super valuable for longevity clinicians in particular.
That's fascinating. I think it's also, to your point there, I think it's going to break down a lot of silos because the patients are going to demand that their records are not stored in all these different places where they don't talk to each other.
Yes.
If they're, hiring a hospital, hiring another clinic, or they're doing, establishing a relationship, think there's going to be a pressure now to have all that data flow to one central repository. So
right.
We'll see. I mean, there's a lot of, unfortunately built-in incentives in the healthcare system to keep that data siloed because that's how they keep patients in their ecosystem.
Right.
But I hope that those walls will crumble down and the data will just flow.
Yes, I do too. What other tools are you actually currently using? I know we talk about a ton of tools for our workflows, but you've mentioned some dictation apps like Granola, but tell me a little bit about how you're using something like Whisper, which I think is super exciting.
Whisper is great. I really love Whisper. I am not someone who likes to type. I'm not a fast keyboardist, and so it's not fun for me, and it just feels annoying because I can't get things out as fast as I want them to.
Yes.
And I also have not been impressed with the native dictation on my computer. I'm an Apple Mac user. Previously, I was on PCs. I was trying to use Dragon. It was annoying. It did okay, but there's just a lot of editing, a lot of errors, and just it slowed me down. It drained me. So Whisper is the new sort of AI dictation platform. You can load it on your computer. It works best on the computer. You can also load it on your tablet or your phone, where it works well, but not quite as well, not as seamless. But basically on the PC or on the computer, I can just hold down the function key and dictate to any field. Text messages, emails, even filling out forms.
So cool.
And so this is actually part of my workflow with patients also. And the thing that's cool about it is it's AI enhanced, and so it doesn't change what you're saying. It'll capture what you're saying, but if you misspeak or you jumble a word or you speak double or anything trips up, it'll fix that on the output, right? And so the error correction is much lower, and so really fast, really seamless in my opinion, and it's just been a really nice game changer for me. In addition to the mainstream sort of consumer AI platforms like Claude and ChatGPT, I'm also using probably my top 2 to 3 other ones are Consensus.app and Open Evidence. I really like Open Evidence. It is somewhat mainstream, so it kind of gates
conventional.
Conventional, meaning so like evidence-based, quote unquote, and so it won't necessarily give you what I think is the correct information on hormone replacement or especially anything when you get off into like peptides or where there's fringe or not fully fleshed out science.
Right.
My Open Health is an interesting project out of Harvard. Some colleagues I met at the ARDD, the Aging Research and Drug Discovery meeting in Copenhagen last August. They're building that. Future House is really interesting.
Yes.
What about you? What do you?
I love Future House. I think it's the most research-informed tool that I use. So really good at curating the evidence. Functional Mind also is a more functional medicine-intended tool for research curation, and then also some lab interpretation. I have to tell you, my favorite tool right now is NotebookLM.
Oh, NotebookLM is amazing.
My favorite tool. So I use it for several use cases. One, we collect a lot of PDFs and webinars and documents that have all of this information. I can create this very specific knowledge base and repository, chat with only the data that I've uploaded. And now, they've expanded the capabilities of NotebookLM significantly. So you can create videos, podcasts, mind maps, reports, quizzes, flashcards within seconds. And now you have this enriched database that you can now pull from. And then what I also really like is it will now actually curate more evidence sources based on the sources that you've uploaded. So I think about like my clinic notebook in medical school and how archaic that now seems, and what we're working with now with the NotebookLM. And from a practice standpoint, what's really helpful is you can upload some SOPs to NotebookLM and essentially create like a training ground that, new staff members can chat with and say, hey, what is the policy for cancellations within 24 hours without them having to manually go to SharePoint, look for the document, review it, and then figure it out. So from an operational friction standpoint, NotebookLM has kind of been a game changer for me. Yeah,
and then it references you back to the place in the Google Doc.
Yes.
You click on whatever the number is,
so
number
good.
6, it goes exactly to which document where it was so that people can cross-check it.
Yes.
Yeah, I agree. I love that one.
Yep. Any other tools that you're particularly excited about?
Granola. So I want to go back to Granola for a sec because that's a note taker, again, not HIPAA compliant. But one thing I've been doing that's really fun is when I'm at a conference, I'll use Granola to record the meetings, to record, to listen in and generate a transcript off of a conference talk. And then you can put them into a folder, and now you have actually your own personal LLM of that conference. And so you can query, you can ask, what did this, tell me everything, is it longevity roundtable, longevity global, tell me everything that everybody said about SGLT2 inhibitor, or tell me about rapamycin, or whatever the treatment is, peptide, and it'll give you who said what across the whole meeting, right?
That's incredible.
So incredible for learning, but also for content generation.
Right.
You can sort of use that to research speakers or generate social media posts, so that one's been really, really fun.
Oh, that's a great tool. And so as we wrap up today's podcast, for practitioners that are new to AI, if you had one piece of advice for them for how they might start to explore how AI might benefit their workflow, what tip would you provide to them? Yeah,
so one, point that we made during our lecture today was that there's this wave analogy. And I think there's a couple of ways to think about that. On the one hand, we are on this wave of AI, and we've talked a lot when we speak about this publicly that we want everybody to be on that wave and surfing that wave to whatever capacity they can, because it's not going anywhere, and we don't want people to be left behind, right? And or feel uncertain or scared about using these technologies, right? I think we're all going to need to learn to some degree how to incorporate these into our practices, into our lives, and understand some of the potential benefits, but also some of the risks and pitfalls, and what that's going to say for us as a society, global society, right? So number one, get on that wave. And number two is that there's so much happening that sometimes, pushing that a little further, not a wave, it feels like a tsunami.
Yes.
Right? And so just acknowledge that and understand that that's how we're all feeling. Even you and I feel that.
Yep.
And it's hard to track, who's doing what and what the companies are and what the value add is, and because there's also this gold rush happening, and everyone is calling themselves AI everything right now, right? And so who are the true players, right? So I think my core suggestion that we've talked about is just pick a few platforms that you feel comfortable with and just start trying it.
Right.
If you're already on that wave and you're trying things, then push some of the capacities that we've been talking about and try to up-level that, and try some new platforms and try to build your own GPT or vibe code something, and just kind of keep growing.
Yep. Well, thank you, Sunjya. I always feel so inspired and excited to keep trying AI and develop our skills every single time we talk. And if you're feeling really excited and motivated to learn more, please explore the landing page for the Innovations in Clinical Implementation podcast. Sunjya and I have put together an entire glossary of terms that we covered both in our talk and today, as well as some of the custom GPTs and tools that we built on that landing page for you to kind of play around in and dip your toe into the AI experience. Thank you for joining us today, and thanks for a great talk.
My pleasure. Yeah, thanks for having me. If anybody has any questions, you want to reach out personally, feel free. Happy to network and to see if there's ways that we can help.
Awesome. Thank you.
Yeah, thank you.